Welcome back once again, YouTube. Skippy02 here. Today we're going to be doing a little discussion regarding medical. Specifically today, EDC medical. It's everyday carry. What I feel is basically the minimum you should have on your person. Pretty much every day. What you see around here are a few of my IFAKs and trauma kits. Going to be doing reviews on all four of those and discussing what I have in them individually and so forth. Maybe it'll be like a little comparison. But right now, we're going to talk about this. As you can see, this is my EDC-ETK, which is Everyday Carry Emergency Trauma Kit. And it's a little worse for wear, but gets the job done. Simply a Ziploc bag. There's nothing real super fancy about that other than it can be collapsed down, relatively rigid to that size there. I typically wear cargo shorts or cargo pants, so this easily fits in either cargo pocket. Let's see. How wide does that come out to be? Just about 6 inches wide and 4.5 inches tall. Maybe 2 3/4 inches thick. So not that big. Couldn't tell you what it weighs, but it don't weigh much. I guarantee it doesn't even weigh a pound. But we'll open it up. I'll show you what I carry in here. Right off the bat, Rat's Tourniquet. Relative newcomer, but these things, awesome. Very compact, very light. They work. Maybe not quite as well or as effective as, say, a CAT or a soft TW or soft TTW, whatever, but nonetheless affordable, light, compact, easy to carry, 100 different ways to carry. At the very least, you should have one of these, if nothing else, at the very least. Emergency bandage. This is basically a 4-inch Izzy bandage. Now I'm not going to tear this open and show you what that looks like, and I'm not going to go into the probably dozen different uses you can get out of an Izzy bandage. There are probably another dozen YouTube video makers, channels, whatever, that have done that, and God only knows how many more are probably out there. But anyway, Izzy bandages, one of my favorite things for trauma care, period. And the 4-inch is nice and compact and still has all the great features of the 6-inch, only without the occlusive pressure piece. Quick Clot Combat Gauze. This is Z-folded. When you bust one of these open, this stuff just, it's amazing. It's like 12 foot of just folding gauze, and it's got the hemostatic agent. The Quick Clot is literally embedded into the gauze, so for a large laceration or a wound, specifically like the wound channel, you can pack this into it, and you're doing two things. You're packing that wound off, and you're employing the clotting agents to help stop bleeding. Pair of nitrile gloves for my big fat bear paws. Pack of sterile rolled gauze. I don't know, it's another 12 foot and change. This, if we had a massive wound channel laceration, something really extreme, if this didn't pack the wound fully, I would back it up with this if need be. And then last but not least, good old-fashioned all-American duct tape. This little deal here, which is however thick that is, just for shits and giggles as it were, we'll say 3/8 of an inch thick. Anyway, this is 8 foot of duct tape rolled around common tongue depressor. It's not real fancy or anything like that. It's just a tongue depressor that I rolled the tape around on this half and did the same on the other half, then snapped it off, put this in my kit, put the other half in my wife's kit. But it's 8 foot of tape, pre-folded, so you can pull it. And duct tape, 1,000,000,001 uses. Here's a couple you may not have thought of. Small cuts, nicks that, you may slice your finger on something and need a few stitches, whatever, but you're nowhere near a hospital or whatever. Duct tape will fix that expediently. More severe case example would be a, say, severe chest laceration, GSW, something along those lines. You may notice in this kit there was no chest seals. However, there is this bag. This bag can easily be torn if need be, or cut with a pocket knife. Most everybody would have a pocket knife on them or handy, whatever. But in a worst case example, you could literally take this and just pull it and it will tear apart. That combined with this, you've just made yourself an impromptu chest seal, or any kind of, wound dressing cover. Sorry, the technical term slips my mind at the moment, but what have you. This is what I carry on me every day. If I leave this house, 99.99% of the time, I'm going to have all of this on my person or in my pocket. It's very basic, it's very simple, but any relatively severe trauma, this will probably contend with. So that's what I do, that's what I carry. What are your thoughts? What are your comments? Let me know. Put them down there. What do you carry with you every day to stop the bleed? To probably, they say, you are more apt to use emergency medical than you are your gun. If you carry a gun every day, you have the tool to inflict grievous bodily harm on somebody. But do you have the tools to counteract that same grievous bodily harm? I don't know, something to think about. But there we go. You could pick these up off the interwebs. I don't know. Rats tourniquets go about $20. Izzy bandages, probably $8 to $10. This, not exactly that cheap. I want to say this is about 20 or $25 maybe, something like that. Maybe 30. I don't know. Shop around. You can also find, like all of this stuff, you could find other manufacturers, variations and brands. This stuff is about 50 cents a blob. The gloves, I couldn't even tell you what they cost. I buy them in bulk, like 100 pack. And duct tape, that ain't gonna cost you nothing, because odds are you've already got some laying around, and you've probably got some of this laying around shoved up under your kitchen cabinet somewhere. Anyway, simple, easy, but effective if need be. But I seriously would like you to consider carrying some medical if you're not already, and get some training on how to use some of this stuff, especially basic EMT course, CPR, these kinds of basic triage assessments and so forth. You can find most places probably in and around your community that offer those types of courses and classes, and that is valuable. I just can't even express to you how valuable that kind of knowledge is to have, folks. Take that into consideration as well. Anyway, I've gone on enough. Thanks for watching. Take care of yourselves. Take care of each other. And God bless.